Good afternoon. I'm Dr. Kenneth Candido, the chairman of anesthesiology at Advocate Illinois Masonic Medical Center in Chicago. I'm also a clinical professor of both surgery and anesthesiology at the University of Illinois College of Medicine in Chicago. The topic for this afternoon is the cost effectiveness of neuromodulation. Dr. Paul Verrills from Melbourne, Australia, conducted a very extensive review looking at the evidence as well as the effectiveness and safety and the cost effectiveness of using traditional spinal cord stimulation. This is published in the Journal of Pain Research in 2016. And Verrills and Associates found that spinal cord stimulator traditional use was safe, effective, and drug-free, or it was also a cost-effective treatment for many types of chronic pain conditions. They found high levels of evidence existing for the safety, efficacy, and cost-effectiveness levels 1 to 2 for traditional spinal cord stimulator therapies. More than half of all patients with chronic painful conditions of the back and limbs experienced sustained and significant levels of pain reduction. So there was level 1 evidence for both SCS using the dorsal root ganglion approach and high frequency HF10 types of neuromodulatory devices. And there's compelling results compared with traditional therapies. The body of evidence continues to accrue, and the newer iterations of SCS therapies such as DRG, high frequency, and burst continue to evolve. A number of variables have been identified determining the success for the use and implementation of spinal cord stimulation, including the experience of the implanter, using appropriate patient selection, taking into consideration other comorbidities, including patient smoking and body habitus, psychiatric illness, and the delay in implantation of the devices following the onset of pain. Dr. Charles Okendorf from Yale University School of Medicine conducted a review of spinal cord stimulation versus conventional therapies for the treatment of chronic low back pain and leg pain. This was a systematic review of healthcare resource utilization and outcomes over the past decade. This was just published this year in the Journal of Pain Medicine. They looked at a systematic review of 11 studies on healthcare resource utilization, as well as the cost effectiveness of spinal cord stimulator therapy, and compared that to conventional medical management for patients with chronic low back pain and extremity radiculopathic type pain. In 8 of the 11 studies, they found that the use of spinal cord stimulation was associated with favorable outcomes and was found to be more cost effective than conventional therapies. In fact, if you look at the graphic in Table 3 included in the slide, the average pain scores started out both in the conventional medical management group and in the spinal cord therapy group at about 8.2. And with treatment in the conventional medical management group, the pain reduction went from 8.2 to 6.7. In contradistinction, the pain in the spinal cord stimulator group went from 8.2 to 4.5. So there's a substantial reduction in pain with the use of neuromodulation. And the number of patients who had greater than 50% pain relief at 6 months was only 9% with conventional therapy, but was about 60% or 48% in greater than 50% pain relief at 6 months using the spinal cord stimulator. Just as importantly, the health-related quality of life scores, including the quality adjusted life years, was 21% at 6 months only with the conventional group and 62.6% at 12 months in the patient who received spinal cord stimulator therapy. And this is translatable. This translates into healthcare utilization resource savings as well as expenditure savings, as we'll see in other additional studies. Dr. Sam Eldabe from the United Kingdom, who's published a total of about 10 papers in his scientific career, but most noteworthy, has published a very substantial body of evidence in terms of spinal cord stimulator use, published a paper this past year looking at, does a screening trial for spinal cord stimulation in patients with chronic pain of a neuropathic origin have clinical utility and cost effectiveness? This was the results of the trial STIM, a randomized controlled trial. And so the basic premise of this was that we have, by convention, used trial spinal cord stimulators before implantation in the vast majority of patients. And that's based upon insurance constraints as well as implanter preference. And so we know that the use of a trial spinal cord stimulator has a sensitivity of about 100%. That means that individuals who have the condition should be benefited by the condition. However, there was no difference when a trial spinal cord stimulator was used versus a non-trial group in the proportion of pain responders or other secondary outcomes. The mean numerical rating score of pain diminished from 7.47 at baseline to 4.28 in the trial group, the patients who had a trial spinal cord stimulator used, at 6 months. In the non-trial group, there was a similar reduction from 7.54 baseline down to 4.49. And so while the trial spinal cord stimulator strategy generates more quality adjusted life years, this is at an increased cost of about 78,895 euros for the additional quality adjusted life year gained. What this means is that it may not be essential or cost effective to perform trials of spinal cord stimulation prior to consideration of permanent implantation. Dr. El-Dabby once again published a very important paper just this past year in Value Health in 2020, which was a systematic review looking at the economic evaluations reporting the cost effectiveness of spinal cord stimulation. This is a very important paper that I encourage all of you listeners to pull up and read at your convenience. Essentially, they were looking at long-term outcomes versus short-term outcomes. And I can tell you that there were 5 investigators in Dr. El-Dabby's paper, 5 investigators who completed the vast majority of the long-term outlook, looking at the economic evaluations of using spinal cord stimulation versus conventional medical management. They include Professors Taylor, Simpson, Kumar, Kemmler, and Annemans for the long-term use of spinal cord stimulation. And this systematic review found that despite the higher costs in the initial stages of treatment, spinal cord stimulator use is cost effective when considering the improvements in the quality adjusted life years in the long term. And these studies go out up to about 15 years. And this is particularly true when we're talking about the use of spinal cord stimulation for the management of neuropathic pain. And by neuropathic pain, the diagnostic categories I'm considering include failed back surgery syndrome and complex regional pain syndrome. And so in the long term, clearly there's a cost effectiveness of using spinal cord stimulation compared to conventional medical management. Also in the short term, we see that studies have accrued as well with Drs. Taylor, Slang and North, Kemmler, Hollingworth, and Dyer, looking at this phenomenon in the short term up to 1 to 3 years, also finding an accrual of new data suggesting that spinal cord stimulator use is also cost effective for failed back surgery syndrome and complex regional pain syndrome. Dr. North has been a proponent of the use of the wireless or stim wave type of device for neuromodulation, which is an implantation process that does not require a separate trial. And again, if you think about eliminating the trial, as we talked about earlier, you can imagine that there will be a potential for cost savings associated with going straight to implantation. And in the United States, of course, conventionally, we've looked at using a trial prior to making the determination as to whom is a suitable candidate for permanent implant. And we've always used, in a fairly arbitrary and capricious manner, the cutoff being 50% of pain relief during the trial period, with temporary electrodes being placed before the patient receives an implanted pulse generator for long-term use. However, this study published by Dr. North and associates recently in 2020 in the journal Neuromodulation tends to suggest otherwise. And if you look at the costs of conventional medical management, the wireless spinal cord stimulator offered a higher clinical effectiveness at a lower cost, and therefore a higher net monetary benefit over the use of an implantable pulse generator and spinal cord stimulator, and also cost effectiveness compared to conventional medical management. In the patients who were managed conventionally medically, the average cost was about $44,000 and change for quality adjusted life years. When the implantable pulse generator spinal cord stimulator was used in a 2-phase procedure, including trial and permanent implant, the cost was about $40,700 in quality adjusted life years. But when the wireless device was used and went to permanent implant immediately without the requirement for a trial, the cost was about $35,500 in quality adjusted life years. So you can see that their conclusion appears to be justified, that not only was the use of the non-trial wireless device effective in terms of reducing costs, it also was effective in terms of reducing hospitalizations and visits. And as this slide demonstrates from the same study, individuals were about half as likely to require rehabilitation services compared to conventional medical management. They were about half as likely to require analgesic therapies compared to conventional medical management. They were also about half as likely to require consultations and medical specialist visits. So there was a substantial benefit in cost savings, which could be translated and which could be extrapolated from patients requiring less medications and from patients requiring less visits to specialists and to other practitioners. Dr. David Abejon from Spain has looked at cost consequence analysis, which examines the differences between a non-rechargeable versus a rechargeable system. And this was published this year in Anesthesia Pain Medicine, showing that the use of a rechargeable spinal cord stimulator batteries saves up to about 56,000 euros on average over patients' life expectancy, which is a savings of about 43% compared to when a non-rechargeable spinal cord stimulator system is used. And so this is, again, a look at not different devices, except different implantable pulse generators, the rechargeable versus the use of a non-rechargeable type of a system for neuromodulation. The group from Italy is led by Furio Zucco, was a cost effectiveness study and cost utility analysis of spinal cord stimulation in patients with failed back surgery syndrome. These are the results from the PRECISE study. And essentially they looked at 80 patients. It's an observational type of study, patients who had predominant leg pain, which was refractory to conventional medical management, who were expected to receive a spinal cord stimulation and ongoing conventional medical management. And what they found, that the cost utility acceptability curve suggested that if the decision maker's willingness to pay per quality of adjusted life years was about 60,000 euros, the implantation would be cost effective in 80 to 85% of cases, respectfully. And that's a substantial benefit to patients who are deemed to be appropriate candidates for consideration of neuromodulation, again, from the Italian group led by Furio Zucco. Dr. El Semedici and associates did a study of the impact of insurance providers on the overall costs in failed back surgery syndrome. This is a cost survey and study in over 122,000 patients, published a few years ago in the journal Neuromodulation. And they pointed out appropriately that 2 out of 5 patients who undergo surgery for chronic spinal conditions, or 40% of them, will fail to derive substantial benefit, either of their back pain and or their lower extremity radiculopathic pain. That's a 40% failure rate. And in those patients, the estimated healthcare costs in the United States is about $20 billion. It's an enormous burden on healthcare costs. And spinal cord stimulator use was found to be cost effective across all insurance groups in this study, not just in commercial insurance or workman's compensation, but also in Medicaid and Medicare patients, showing that other individuals not with commercial insurance may be benefited, and the cost savings may be substantial when we consider neuromodulation for patients who have failed to derive substantial benefit surgically. In summary and conclusions, it has been shown through a multitude of studies over many years, going back at least to 2005, if not earlier, that spinal cord stimulator use is cost effective after about 2 years in most studies. And those were the studies of Kemmler as well as Kumar for neuropathic pain compared with conventional medical management. I thank you for your time and attention. Have a good day.